today is on that upper left area where you came in with your complaint that you had a bridge that's loose. Well, we took an x-ray here, Ralph, and you can see there's some areas on the bridge where it's potentially broken. And the bridge is about 12 years old, but somehow, some way, the bridge worked itself loose. So what we're going to do today is I'm going to remove the bridge, check the area underneath it, make sure that the teeth are healthy. If there's any decay or any problems with it, then we'll talk about it. But ideally what we want to do is rebuild the teeth up so that we can put a new bridge on it. And it's not very hard, very straightforward. And what we can do now for you, unlike 12 years ago, is your new bridge will make it out of all, it's called an all ceramic bridge, where they'll actually use a digital model that can help fabricate the bridge so it's much more accurate than it was back then. And by having that, that sometimes allows you to have a bridge that seals better, and you have potentially less leakage or things like that that can happen underneath it. Okay. All right, so go ahead and lean your back here while we do this.
Oh, I want to look good while you're doing this. For all my fans on the internet that see all these dental procedures that I'm experiencing.
That's right.
Because I didn't take care of my teeth when I was younger and older.
Okay, so let's take a look here, and let me just show you. Let me explore. Now Ralph's already been numbed up here. But if we look at this bridge in the back, you can see where it's broke right here, and you can see here where it lifts up. So the bridge is worked loose. Like that. Now this is a 4-unit bridge, so it goes from here, 1, 2, 3, 4 teeth. So it's still attached up here, but we got to take this off. So rather than trying to tap this off, I'm just gonna section this bridge right here so that we can get it off without damaging his teeth. Loosen this a little bit. It's worried. Let's do that one. You're right, Ralph. Let me see if I can loosen this a little bit more, Ralph. Looks like that was ready to break off anyways. Okay. Let's do this. See them under it. There we go. Okay, so there we have. You know what the teeth look like. And what we want to do is just look at the health of the teeth underneath. And look for decay. You can see on we had a root canal done on this tooth. Let me see, Explorer. And right here, this orange area, that's root canal filling material. So what we're going to have to do is rebuild that tooth up a little bit to give it some strength. And that tooth looks healthy, Ralph. So that's good. And the very back one looks healthy too. You can see that you do a good job cleaning your teeth. Your gums are pretty pink and look nice. So you're doing all the right things in the care. The bridge just wore out. That's just really what happened. Okay. What I'm seeing here, Ralph, is I've removed your bridge. And right in this area here, I don't know if you can see this, Deanna, but it looks like a root canal was done on this tooth, number 13. And on the tooth, it looks like they were only able to find one canal. And this tooth has two canals. So I found the second canal. If you look on the X-ray here, you'll see that there's one root canal done right here. And ideally, there should have been a second one. So what we're going to do today, in addition to doing this bridge, is I'm going to go ahead and treat that second canal and seal that so that he doesn't have a problem with it later on. And so I'm going to have her go ahead and get some root canal material stuff, and we're going to go ahead and get that done. Okay, so what we did is we went ahead and we saw that only one canal had been finished previously from 10 years ago. So the tooth has never had a problem in 10 years. But since we had access to the tooth, we went ahead and redid this root canal and sealed it. So now with the new bridge, you ideally shouldn't have any problems with that. So let's go ahead and continue on. And what we do is we put some etchant on the tooth, and then a little bit of bond so that the buildup material will adhere to the tooth. And that way the tooth is a little bit more, has a little bit more strength to it, and will support the bridge a lot better. And what the light does is an ultraviolet light that is a catalyst that makes the material go from a kind of a doughy type consistency to a hard consistency. All hard.
Bite out?
Go ahead and bite together. We want to make sure there's clearance. Which in this case, there is plenty of clearance here. So, good. Okay. All right. So, Ralph, what we're going to do now is we're going to take the impression for the bridge, and we'll need a full tray for this. And so, what we'll do is we're going to have you bite into this impression material that goes around your teeth into this tray here. Let me try the tray in. Just go ahead and bite together. Just like that. Is that comfortable? Doesn't hurt or pinch anywhere. Okay. Open. And then, so that's all there's to it, is it takes 4 minutes, and you're just going to bite together. You can swallow. I'll sit you up a little bit if you need to. And in 4 minutes, we take it out, and then we make your temporary bridge.
Hold on. Hold on.
Don't worry about her.
It's her hair.
tight together all the way. Okay, just hold like that.
Big, and then let it bite down all the way, bite down all the way. It's just like that. And hold it for 2 minutes. Okay, let's try this. Gently close. Okay, I'm gonna cement it. Add a little bit here because see it's so the margin a little bit. I'm going to use the flow bubble to add it more over here. Cover that. Cover that open magic. Right here. Try the 2 twins. Gently bite down and hold it just like that for a couple minutes. Now I'm going to check your bite. Make sure your bite is good and even. Okay, gently tap your teeth a couple times and open. So the blue mark is telling you that it's hitting high. So I'm going to take off the blue mark. Here. Tap again, tap and grind, and open, and tap here, tap and grind, open. Again, tap and grind, and you tap and grind. Pretty good. Pretty good this morning. How your bite feel?
Feels okay.
Good, even on both sides?
Pretty much, yeah.
Okay, right. Okay. Alright, that's it. So I'm gonna put the seat. So I think I'm gonna go 83.5. So I think this is matched with your front bridge. Is that okay?
Uh-huh.
Okay, I'm gonna go with 83.5. Okay. Alright, so be there.
Okay. Thank you, Molly.
You're welcome. Take a look at the bridge first. The bridge first. Looks fine. Okay, ready? I'm gonna take the bridge off. Okay, the temporary bridge off. Bear with me. Alright. And I'm gonna clean the excess cement around the teeth underneath the. Okay, let's rinse. Close down, open. Close down, open. Check it again. One more time. Yeah, one last fence. Is it cold? Okay, let's try it.
You're welcome.
Contact is still too tight, so I'm going to use a little bit to make it fit good. Tight.
And let's just polish some of these spots here. A little bit of water here. Now, how's that feel to your tongue?
It's good.
Okay. When you bite together, how's that feel?
It feels even on both sides.
Feels pretty good now? Okay. If we need to do more, later, let's say you go home and chew with it and you go, it doesn't feel quite equilibrated, then we can do more.
Okay.
Okay. How's it feel to your tongue over there? Do you feel any areas that are going to bother you in any way?
Yeah, it feels good.
Okay. Okay, so what we want to do here, let's go ahead and get the cement out. The idea on polishing bridges is you want it to be smooth so that the wear on your opposing teeth is as even as possible, because porcelain can wear against your natural teeth or against other porcelain, and the more even it is or equal, then they tend to last longer. Whereas you'll see a lot of people that it won't be that way. They'll have like you've experienced, they'll find that some of their natural teeth may wear down if there's an uneven hardness or abrasiveness.
Mm-hmm.
Right on this cotton roll, good steady pressure. Open. And bite again. Open. Get in there. Okay. Then bite together. Does that feel like it's all the way down?
Mm-hmm.
Go ahead and bite on this cotton roll. There you go. And now we want you to hold steady. It takes about 3 or 4 minutes. And we'll clean around all the cement. We'll make sure everything feels right to you. And then Milan can, if you don't know how, she can go over how to clean underneath it with a bridge floss threader. Okay.
See, open. Clean this. Okay, I'm gonna flop. And I'm gonna show you how to flop too, okay? In between the fish. Oh. Back. Okay, let's try to get this. Okay, under the bridge. This and the missing tooth, so you can slide back and forth like that. Here. And thread through. And this, you can go up and down. Okay. That's the underneath here. You go down here and here. And slide it back and forth and thread through, okay? And see if I can do it one more time. You can see it. Okay?
Okay.
Alright, so how your bite feel? Good?
Good.